Dr. Jocelyn is a board-certified urologist with over 30 years of experience specializing in men's health and intimate wellness. She has helped thousands of patients improve quality of life through science-based, compassionate care. Every man believes he knows which positions women enjoy, but most are mistaken. This is not provocation, but an invitation to an honest conversation. I am Dr. Jocelyn, a urologist at the Mayo Clinic in Rochester, Minnesota, with over 30 years of experience helping couples reconnect and rebuild trust through intimacy. Throughout my career, I have heard thousands of similar stories. Men who care deeply and try sincerely, yet feel confused when their partner seems distant during intimacy. Almost always, the answer is not passion, but physiology. How the female body responds and what it needs to feel safe, comfortable, and fully alive. This discussion is not about tricks or fantasies. It is about human science, anatomy, and respect. I will explain 5 positions women tend to enjoy because they suit their bodies, and also 2 popular positions that often cause discomfort. More importantly, you will learn why. How adjusting angle, rhythm, and contact can transform the experience into something natural and mutually satisfying. Before we talk about positions, there is one fundamental truth. Female pleasure does not work the same way as male pleasure. While men often respond to depth, rhythm, and intensity, women rely on 2 elements at the same time: steady blood flow to the pelvic tissue and consistent external stimulation at the front of the pelvis during internal movement. Without this combination, sensation fades. Decades of research in sexual medicine confirm that only a minority of women reach climax through internal movement alone. Most need or prefer simultaneous external stimulation where the greatest concentration of nerve endings exists. When men focus only on speed or depth without maintaining frontal contact, they may feel ineffective, when in reality they are emphasizing the wrong elements. I have seen couples married for 20, 30, even 40 years rediscover their connection with a simple adjustment, shortening movement and maintaining gentle forward pressure. The female body responds to stability, not haste. Another overlooked factor is nervous system relaxation. When a woman feels tense or forced into an uncomfortable angle, her brain shifts into control rather than pleasure. When she feels safe, the parasympathetic system activates, circulation improves, and sensation flows naturally. That is why favorite positions are rarely flashy. They allow easy frontal contact, gentle angles, and freedom to move comfortably. This is our map. For each position, we will focus on 3 things: why it works clinically, how to adjust it, and how to know if it is working. Number 5, side-lying spoon. This simple position is one of the most effective for comfort, connection, and endurance. Lying on the side reduces muscle strain, protects joints, especially for couples over 60, and maintains closeness. Medically, it keeps the pelvis parallel, preventing uncomfortable depth and allowing pressure control. It also leaves a hand free for external stimulation. Clinical advice: place a small pillow or folded towel between the knees to align the hips and reduce lower back tension. Keep movement short and rhythmic like a gentle sway. The key is sustained pelvic contact, not speed or strength. There is no rush. Breathing together matters more than depth. One partner sits on a firm surface while the other sits on their lap, facing them. Direct eye contact stimulates oxytocin, the hormone of bonding and trust. Chest-to-chest contact synchronizes breathing and reduces muscle tension. The seated partner provides stability, while the partner on top controls rhythm and depth, turning thrusting into a rocking motion that maintains frontal pressure. Clinical advice: think rolling and pressing, not pushing. Tilt the torso slightly to adjust intensity without losing alignment. This position requires little strength and is excellent for limited mobility. Often underestimated, this position allows deep emotional and physical connection. Matching breathing rhythms helps the nervous system synchronize and improves bodily response. Placing a small pillow under the hips tilts the pelvis, aligning internal contact with the most sensitive frontal area. Clinical advice: shorten movement and apply gentle forward pressure at the end of each motion. To increase intensity, change the angle, not force. This position promotes eye contact, kissing, and touch, all of which activate pleasure and calm in the brain. Here, she controls angle, rhythm, and depth, allowing her to guide sensation and avoid discomfort. Large surveys show many women naturally adjust hip angle to keep sensation at the front of the pelvis. Clinical advice: avoid vertical bouncing, use circular or gentle swaying motions with constant pelvic contact. Pillows can reduce strain on knees and back. This position increases confidence and emotional safety, allowing pleasure to flow naturally. Often misunderstood, this position can be either uncomfortable or deeply pleasurable depending on alignment. The key is hip tilt. Bringing knees slightly together and rotating hips forward shifts pressure toward the sensitive frontal tissue instead of the cervix. Clinical advice: place a pillow under the hips, use slow sliding movements, avoid force, and maintain external contact with one hand. Communication and shared breathing make this position complete rather than impersonal. The standing shower position looks romantic but creates tension, loss of balance, reduced lubrication, and poor angles. If you like water, move away from direct flow and use a stable surface. The acrobatic legs to chest position often causes strain, nerve compression, and pain, especially after 45. To adapt it, place a pillow under the hips, soften the angle, shorten movement, and maintain frontal contact. Both mistakes prioritize appearance over feeling. The core principle research from the Kinsey Institute and others agrees. Most women experience greater pleasure when internal movement is combined with constant external stimulation. Choose positions that preserve frontal contact first, then adjust depth or rhythm. Breathe together at the start to relax the nervous system. Shorten movements to maintain continuity of sensation. Use pillows as clinical tools to adjust angles, not force. The ideal rhythm is one that maintains constant pressure. Presence matters more than performance. The body communicates through breathing, movement, and sound. Attention is the most powerful guide. Small movements, tilting and swaying, often make the biggest difference. Studies show women receiving continuous external stimulation report significantly higher satisfaction. This requires no technique, only awareness. There is no single ideal position. What matters is the ability to adjust and maintain comfort effortlessly. Couples over 60 who regain intimacy focus less on technique and more on listening. Pleasure is an advanced form of communication. Mature intimacy is not about impressing, but understanding. With age, sensitivity does not disappear. It simply requires new conditions. I am Dr. Jocelyn, urologist at the Mayo Clinic. My hope is that this knowledge helps you approach intimacy with more serenity, empathy, and science on your side. True intimate health begins not in performance, but in how we listen, touch, and respond. Age does not extinguish desire. It invites us to live it with more wisdom.